ahead.
Hi, my name's Dana Miller. I'm the speech pathologist here in Viborg, and I'm just going to do a little bit of training with you guys today on some things to look for, things to be aware of when you're in the dining room with our nursing home residents, particularly with swallowing and with some difficulties that they may or may not be having with swallowing during eating. Probably the most important thing to be looking for are signs and symptoms of swallowing difficulty. So I'm going to list a few for you. Probably the one that most of you are usually aware of would be coughing. Usually if a patient's having trouble with swallowing, you see even a little bit of coughing or a lot of coughing, depending on how they're doing. But they don't always cough, so that's an important thing to be aware of. Something else to look for is difficulty controlling oral secretions. You might see them having trouble with loss of saliva out their mouth, but it could also be loss of food and liquid out their mouth, corners of the mouth usually when they're eating and drinking during meals. An audible swallow. We might hear them swallow very loudly or almost like a sound like it's an uncomfortable swallow, so be aware of that. Also, you might see them swallowing several times, so they'll take a bite of food, chew it up, swallow 2 to 3, sometimes 4 or 5 times per bite. You might see them have a swallow delay, and that means like you'll see them put the food in their mouth, chew and chew and chew, and then you won't see a swallow for a while. So just be aware of that it might take them a while to start the swallow. Or there's sometimes not a symptom at all, and that's a little bit of concern because we call that silent aspiration, where a person is actually having food or liquid go down into the lungs instead of the esophagus, and they're not having any cough, any kind of reaction to that at all. So it's important to pay attention to the other signs so that if there is silent aspiration, at least there's something else that we could be looking for. The use of thickening agents for liquids. The reason why we do that is there's a couple of reasons, mainly because it does help prevent aspiration. Liquids are known to go down very, very quickly. So if we add a little bit of thickener to them, it actually slows them down and gives the resident a little bit more time to swallow, and it might help protect the airway a little bit. Also, a little bit of thickener also helps them control the liquid in their mouth a little bit better so that we won't have as much escaping out the mouth. So a liquid can be, of course, the nectar thick or mildly thick, honey thick, which we call moderately thick now. So there's not a lot of honey thickness that you'll see anymore, but mainly the mild and moderately thick liquids. Okay, and then the last thing would be the diets, the pureed textures, ground meats versus regular textures. Every time we offer or recommend an altered diet for a resident, it is because either they have an oral difficulty, trouble chewing, trouble getting the food into a cohesive little bolus to be able to move it backwards in order to swallow it safely. Sometimes they have trouble with the food being scattered all over in their mouth. They can't control it very well. And then also they might have escaping little pieces of material that might go down their throat before they're ready to swallow. Those are just a few of the reasons why we recommend altered diets for them. And I think that I would like to ask us all to be encouraging regarding these diets. Much of the time, they're very temporary, and it just is a matter of time to help the resident improve his strength, maybe learn some compensatory strategies. So it's very important not to say things like, oh, I wouldn't want to eat that either, or it's too bad you have to have those thickened liquids. Let's try to be encouraging and hopefully just kind of get them through it. Say things like, well, you can do this for a little while. This is only to help you until you can build up your muscle strength and learn some strategies to get through it. So I think that that's probably all I have to cover today. If there's special recommendations for our residents, I do write those recommendations in the CNA book. So if there's ever any questions regarding specific recommendations, they should be in there. Otherwise, I'm usually available a couple days a week, more in the late afternoons and evenings. So thank you guys. Hopefully if you have any questions, I'll be available. Thank you.